Hi, my name is Vivian, and for my disease presentation, I am doing Loiasis. So, Loiasis is also known as the African eyeworm or Loa Loa infection, and it's basically a parasitic infection caused by the nematode or roundworm called Loa Loa. And this parasitic worm is transmitted to humans through the bites of infected deer flies or mango flies in certain regions of Central and West Africa. So the Loa Loa morphology. So in adult worms, which you can see in this image right here, that's what the adult worm looks like. They're long, slender, and thread-like in appearance. The length varies from 7 to 12 centimeters, and they are sexually dimorphic, which means there are separate male and female worms. They are also characterized by a cylindrical body with a pointed anterior end and a more rounded posterior end. And then the microfilaria, which is this image right here, they are the larval stage of the Loa Loa that are released by the female worms into the bloodstreams. The microfilaria are sheathed, meaning they are enclosed in a protective covering, and they usually have a distinctive coiled appearance and are microscopically visible in the blood samples. So for their life cycle, so to start off is the adult stage in humans, and the male and female worms reside in the subcutaneous tissues of humans. And as I mentioned before, the female worms are the ones that release the microfilaria. And then after the release, it circulates into the peripheral blood of the human hosts, and then the presence of the microfilaria in the bloodstream allows them to be taken up by the blood-feeding flies mentioned before during their blood meal. And then when they're ingested by the cyclops flies, it also takes up the microfilaria along with the blood, and then they start developing inside the fly. So the microfilaria undergo a development to become an infective larvae. And then the infective larvae migrates towards the mouth parts of the fly, and then where they can be transmitted to new human hosts during their next feeding or their next meal. And then the cycle starts all over when the infected fly bites another human and then deposits the infected larvae onto the skin. So the larvae enters into the skin through the bite wound that the flies leave, and then they would migrate to the subcutaneous tissues, and then that's where they would develop into adult worms, completing the life cycle, and this just keeps going on. So for transmission, there are the primary vectors responsible is a certain species of the Cryops flies, and they're particularly the Cryopsilacea and the Cyclops dimitata. So their appearance is like a horsefly, which they have, as you can see in this image, a robust and stout body, and their body is usually brown or grayish, and their wings are often clear with dark markings. And they can range the Silacea can range between 8 to 12 millimeters, and the dimitata can range from 10 to 15 millimeters. For the Silacea, they transmit the larvae of the parasite into the bloodstream while the Dematata, it introduces the microfilariae into the bloodstream. So for the Loa geographic distribution, it's like very specific to Central and West Africa, also including like the rainforest areas. So the regions of Central Africa include Cameroon, the Republic of Congo, and like the Equatorial Guinea. And then for West Africa, there are some parts including Nigeria, and then parts of the rainforest region of the Ivory Coast. So for the symptoms of Loa, there's this one symptom that's really particular to Loiasis, which is calabar swellings, as you can see in these images. And they're basically subcutaneous swellings. They are non-tender, and they are localized swellings that can appear in various parts of the body. And as you can see in this image, it's like affecting the swollen hands here. The reason why it's called the African eyeworm is like that's where you can like see the worms themselves, but in actuality, these worms can migrate through all over the parts of your body in your subcutaneous layer. And the calabar swellings is a result of like the extra waste produced by the worms themselves moving around and excreting all the waste, and that's when your body tries to attack and then release all of these extra waste products, and that's what causes the swelling. And because the microfilariae are always like active throughout your bloodstream, so yeah, it's kind of gross. And then some other symptoms could include like redness and itching, and then some individuals can experience joint pain, and this is the cause of like the worms migrating throughout your body and like beneath your skin, and then yeah, you could feel them like moving around. As for diagnosis, it's basically often diagnosed based on the clinical symptoms mentioned before, and the most like popular way to diagnose them is the detection of the microfilariae in the blood, as you can see in this sample. And it's basically blood samples have to be taken during the day because the microfilariae is the most active during that time, which is really interesting. And the blood sample is usually obtained through like a finger stick, and a thick blood smear or a thin blood smear is prepared and stained for the microscope examination. And under the microscope, you can see this microfilariae surrounded by all the red blood cells. And then there are other tests when the microfilariae aren't that active, and one of the tests is the ELISA test, which is an enzyme-linked immunoabsorbent assay. And it can be used to detect specific antibodies against the Loa antigens. And then another way to detect them is through ultrasounds, which is used to visualize the subcutaneous nodules or detect the presence of the adult worms themselves. And then for treatment, the infection is treated through antiparasitic medication, and the most common treatment used is the diethylcarbazine, or known as DEC, and it's effective in targeting against the adult worms and the microfilariae. And the treatment with DEC is usually administered over a period of days to weeks, depending on the severity of the infection. So basically like the concentration of microfilariae, so how much is it in your bloodstream. And then people who get treated with DEC may develop some like side effects, especially with individuals with the high microfilarial loads, which these symptoms or reactions could include a fever, headache, and joint pain. And then in rare cases, if the person cannot take DEC, ivermectin is used, and it's basically another form of antiparasitic medication and to use, and it's also effective in fighting against the microfilariae or reducing the concentration. And most of the time, it's treated with a single dose. And these are my references. Thank you.